Yusek Bernardo C. Flores Jr., Director Juan Jovian Ingeniero, IRD Maria Calpisa J. Sardoa, Honorable Benjamin Malong, PD Cheryl P. Takda of DILG Antique, DILG Provincial Directors, DILG officials, mayors, and local officials are around. Ladies and gentlemen, a pleasant morning to all of you. COVID-19 has greatly affected the way of life of the people in most communities. My town in the province of Antique is not spared from this threat. Thus, local officials, health authorities, and other stakeholders have to implement stricter quarantine and health safety protocols to contain the further spread of the virus. Today, we are presenting to you the simple ways, the practices, the municipality adopted in contact tracing of identified positive, probable, and suspected cases of COVID-19 and how this have helped minimize our cases in the municipality.
Patnongon is a third-class municipality located in the central part of the province of Antique. It is composed of 36 barangays, 10 are located in the coastal areas, and 26 are considered inland upland. According to the 2020 census, it has a population of 38,329.
The local government unit of Patnongon is very grateful to have been blessed with active and cooperative local officials both at the municipal and barangay level and functionaries who have exerted their best to help contain the spread of COVID-19 in the municipality. We are grateful to the different stakeholders for the guidance, the DILG, MHO, and all other heads of offices and agencies to have made sure that our steps and actions are properly organized and within the bounds of law. We strictly implement the policies from the very beginning, regulate movement, and conduct advocacies to inform the public of the health policies to be observed, probably the main reason why we have minimal cases of COVID-19. Today, we're presenting to you our best practice in contact tracing in the municipality. Ladies and gentlemen, Patnongon, moving on through adversities.
National and local policies were passed mandating the observance of appropriate health protocols to stop further spread of COVID-19. At the very beginning, the policies were so strict, like everyone trying to guard his own post. But in any way, it has helped prevent COVID-19 from entering the town. The efforts on contact tracing all began when COVID-19 knocked at the doors of the municipality. In October of 2020, 3 cases of COVID-19 was detected in the municipality, affecting 1 hospital patient with comorbidity and later the 2 other children taking care of the patient. Partnership, alliance, and teamwork. 3 significant words that are almost synonymous to one another. But these 3 have solidified the good intentions of the local government officials and the constituents of Patnongon to stand firm in the fight against COVID-19. The overall operation on contact tracing in the municipality is governed by these best practice. Patnongon, moving on through adversities. The first 3 letters of the words Patnongon stands for partnership, alliance, and teamwork, while ungon is a term for thorn that has deeply set in one's skin or some sharp little things that has rudely lodged itself under one's skin. Now Pat signifies an act of calling everyone attention to do his or her share in fight against COVID-19. It is like a pat on the shoulder as a friendly call for help to take responsibility in taking care or protecting each other from ungon or thorn, which we refer to COVID-19 virus. LGU Patnongon partners with different stakeholders to make contact tracing efficient and effective. The municipal contact tracing team was organized by the virtue of Executive Order number 006-A series of 2020 issued by the municipal mayor. The punong barangays, on the other hand, organized their respective barangay contact tracing teams to help the municipal contact tracing in their operation. All of the 36 barangays in the municipality have organized and active barangay contact tracing teams to ensure that close contacts are traced within 24 hours upon detection. The contact tracing teams seeks the help of the barangay contact tracing teams. This makes all efforts well organized in the identification of infected persons and in tracking down everyone who could have been exposed to the virus. Contact tracing was further enhanced when the DILG started to hire contact tracers. 23 residents of the municipality were hired as contact tracers. Only 13 of them were assigned in the locality. The rest were assigned in other municipalities. Here comes the third hiring renewal of the DILG contact tracers. The DILG added one additional contact tracer, and the LGU hired 2 additional contact tracers. This further strengthened the contact tracing efforts of the local government unit.
Maghalong, maghalong kita tanan, magpati,
The Sangguniang Bayan has also made their contribution in the LGU's advocacy for measures to prevent further spread of COVID-19. Through the SB Chair on Social Services, it has devised a campaign song or parody entitled Maghalong or Be Careful or Take Extra Care. This is an inspiring song that motivates the heart of every depressed individual affected by COVID-19 pandemic. The song encourages every Patnonganon to follow minimum health protocols and be united and to heal as one. They have also enacted an ordinance mandating for the observance of minimum health protocols and imposing penalties for violation thereof. Alliance. Although the term is synonymous with partnership, the LGU has sought the cooperation of different sectors like the business sectors, the market vendors, TODA, and other CSOs in making contact tracing more efficient. The RHU is the most proficient partner in the contact tracing efforts of the LGU. Teamwork. Working as a team makes a lot of essence in contact tracing. During the second rehiring of the DILG contact tracers, only 2 were assigned in Patnongon. Others were assigned in the other LGUs with most cases of COVID-19. It was during this time when the power of 2 DILG contact tracers was tested, having to contact trace around 200 close contacts in cockfighting event. The RHU personnel, barangay contact tracing team, and BHERTS were of great help during the most trying times. Luckily, every close contacts were identified and isolated. With the help of the Municipal Health Office and support of the BHER, those who were traced were isolated or home quarantined. It was strategized that those who were probable suspects or some that are COVID positive are isolated or home quarantine management is based on DOH Memorandum Circular Numbers 0439 or the Interim Guidelines in Prevention, Detection, Treatment, and Reintegration for COVID-19 and number 0258 or the updated Interim Guidelines on COVID-19 Testing Series of 2020. We build as one, we fight this battle as one, and we heal as one. Teamwork begins by building trust. We trust each other's capacities and believe each one makes a contribution to realize our common goal to beat COVID-19. As we apply PDITR in contact tracing, here are some of the efforts we have undertaken. Posting of posters and distribution of flyers relative to the observance of health protocols are done municipal-wide, particularly in public places mostly visited by the people. We believe that when the public gets the right information, further spread of the virus could be prevented. Advocacies in the barangays are also conducted. It is always hoped that subjects tell the truth and give the right information. Contact tracers may go to the field in the process of contact tracing when the interviewee could not be reached by phone or if there is no internet connection. Daily updates of COVID cases are being reported. Conduct of teleconsult, telemedicine with the patients and providing medicines as necessary. All symptomatic suspect probable cases are referred to the local epidemiological surveillance officer for medications or for admission. Same with COVID-19 positive patients. Refer COVID-19 positive probable suspect to Angel Salazar Memorial General Hospital for admission. When COVID-19 positive patients expires, contact tracers help facilitate the burial. Under the MDM guidelines, the local chief executive, as authorized by the Sangguniang Bayan, was able to sign a memorandum of agreement with a funeral parlor in the LGU for the burial of COVID-19 deaths in the locality. Contact tracers sometimes go beyond the point of contact tracing. They are also a shoulder to lean on during those tough times, and they are more than willing to listen to the problems confided by the patient, victims, or their families and give sympathy, emotional support, and encouragement. After isolation or quarantine, subjects are now ready for reintegration to the community as based on DOH Memorandum Circular Numbers number 0439 and number 0258, Series of 2020. Since efforts of the local government unit has given more focus on prevention, early control of the spread of COVID-19 was attained, as shown in the table, thus resulted to minimal number of COVID-19 positive cases. Contact Tracers Daily Monitoring Report. Modified reporting format for positive cases. RT-PCR testing schedule, symptoms and disposition or release of patients. To our valued contact tracers, The contact tracing team, both at the municipal and barangay levels, our heartfelt thanks and appreciation for all the efforts as we continue to move on through these adversities. God bless us all.